Hi, I'm Thomas Foreman, and in this video I'll be showing you how I examine a hip joint. This is Libby, she's my patient for today. Do you mind if I examine your hip joint, Libby?
No, it's fine.
So for this video we'll focus on the right hip. So first of all, just general inspection of Libby, see if she's comfortable standing there, any pain at all in the hips.
No.
And I'll ask her first to walk to the wall and back towards me. Observing her gait, checking there's no pain or movement, any pain in the hip joints when you move, any pain in the knees.
No.
Sometimes hip pain can be referred to the knee or even to the ankle joint. And some people who come in with lower back pain can also experience hip problems. Normally I'd start the examination by inspecting the lumbar spine of the patient. Do you have any lower back pain? No? So it's quite a simple test. What we can do is just, can you bend down towards your knee? And then go back as far as you can, like this. That's it. Any pain on the lumbar spine there? And then if you turn around with your back towards the camera, normally just palpate down the lumbar spine. Any pain when I press on the bones there?
No.
No. So Libby's got a pretty normal examination there. If you turn back towards me. So now we'll focus on her right hip. First we'll start with a hop test. So if you can go onto your right foot and just jump up and down for me. Any pain there?
No.
Sometimes pain on hopping can be a sign of a stress fracture in the hip. Vibrations from the foot can travel up the bones and cause tenderness at the hip joint. Right, for the rest of the examination I'll ask Libby to lie down flat on the bed. And again we'll focus on her right hip. First of all, I like to look from the end of the bed, just to look for any leg length discrepancies. Normally, I'd get a measuring tape and measure from Libby's umbilicus, belly button, down to her hips, down to her feet. They're finding the actual leg length. But as you can see from the end of the bed, there's no leg length discrepancy there. So it's unlikely that her hips are dislocated. Ideally, I'd have the patient adequately exposed to the hip joint, so I can have a better look, looking for any signs of bruising, any swelling, any redness there, any pain in your hip. No. So first of all, we're looking for the ASIS, which is the anterior superior iliac spine, which is part of the pelvis, and then we've got the pubic tubercle more medially. In the middle is where the head of the femur normally lies, so that's what we palpate. And then moving out more laterally down to the greater trochanter of the femur. Pain there, no?
No.
Also, you can look at muscle bulk. Some people may have muscle wasting with hip problems due to limited range of movement. But now we'll move on to movement of the hip joints. First of all, I'll ask Libby to passively move her hip joint. So if you can lift your leg straight up in the air for me. That's checking flexion, normally done by the psoas muscle. And out towards me. So abduction and then adduction over the other leg. That's great. Put it back down. Right, so now I'll take Libby's leg, ask it to come out nice and floppy. I normally do check internal rotation just by rolling the leg in. Any pain there? It's normally quite a specific test for hip pain. Lots of patients with hip pain will have pain on internal rotation, and then external rotation. This isn't as sensitive really for hip pain. Now I'll move on to the exact same movements that Libby just did. First of all, we'll do flexion. I'll try and get more flexion out of the hip joint. No pain there? No. Down to extension. Abduction. Adduction. No pain. No. Now another way to check internal rotation is by flexing the hip joint and then internally rotating like this. This is a bit more specific than the roll test I previously demonstrated. And again, we can do external rotation like this. Like I said, normally athletes with hip pathology will get pain on internal rotation. We'll move on to some special tests now after doing palpation and movements. So if you could bend both your knees up for me, it's called Thomas' test. And keep a hold of your left knee and then straighten out your right one. Now as you can see, Libby's got a normal examination there, a test examination there. Her right leg is lying flat on the bed. You can let that one down as well. Patients with a fixed flexion deformity of the hip wouldn't be able to totally flatten their right leg on the bed there. Next we'll move on to Faber's test. So we can bend Libby's leg up and place her heel over her left knee. Just let the leg naturally sit there, and then we can add some pressure, pushing down on the ankle joint and then pushing down on the knee. Okay? No. Normally this Faber's test would elicit pain in hip pathology there. I like to then move on to check for the groin muscles. Ideally, with the patient adequately exposed, you could palpate the tendons of the hip adductors and abductors, and also the psoas muscle that attaches to the ASIS. I won't do that for the purposes of this examination, but what we will do is test the strength. So if I could ask Libby to push up against my hands, checking the strength of the psoas muscle, and then push down against my hands, right, that's it. Well done. Right, so if I ask the camera to come this way, and then I'll move on to the bottom. We can check the adductors of the hip joint. If I ask Libby to push against my hands, it's good strength there. Any pain? No. And then push out for the abductors of the hip. Any pain there? No. They're normally quite specific tests. If people do have pain on any of their movements or resisted movements, then it's normally quite sensitive for groin pathology. Obviously, we'd also check for any swelling, such as hernias that can appear in the groin. Right, if I ask you to roll onto your front foot. This way we can check hip extension. So again, I'll ask Libby to do it herself first. If you can lift your right leg off the bed. Oh, the other one, isn't it? Yeah, no, this leg, so yeah, focusing on the right. And then back down. And again, I can do this for her. Only 10 to 20 degrees is normal. No pain there?
No.
No? Great, okay. If you can come off the bed for me this time. One more test that I like to do at the end of the examination is Trendelenburg's test, where you place your hand on the pelvis like this, and ask Libby to lift the right foot off the floor. Normally the foot that's still on the floor, that hip will move down, or the right hip actually moves up. And as you can see, it's a normal test for Libby there, and we can do it on the other side as well, just to demonstrate it. So this time, my right hand's moving up and my left hand's staying where it is. To complete the examination, I'd always examine the joint below, which is the knee, and again, like I said, I'll do a more thorough examination of the lumbar spine. But that concludes my examination. Thank you.